Hi, I'm Dr. Gabby Cora and welcome to my Wellness Doctor and Coach certification program exclusively for physicians. Now, why physicians? Well, many of us have really joined our profession to be not only the doctors who help in pathology, but also help our patients achieve their maximum health and wellness, their ultimate health and wellness. And yet, with the current state of healthcare, many of us cannot do this, but at the same time, we've seen many other people come into the healthcare arena and provide for some of the services that we should be providing. So if you feel that you're one of the doctors who really went into medicine to help out, not only fix the problems, but also heal people on a very high level, thank you for joining me. Now, what's particular about this Wellness Doctor and Coach certification program for physicians? Well, first of all, it's given from physicians to physicians. So there's something very unique about that particular part of this program per se. The second one is that we're going to see not only things about coaching per se, but I'm going to help you build your whole empire around health and coaching and practicing medicine the way that you were meant to practice. So this will include tons around speaking engagement, corporate health and wellness programs, consulting programs, coaching per se, of course, networking, social media, and many other things that you would only be able to learn by doing an MBA as I've done, plus joining many other separate programs. This program brings everything together. The third point that is very important here to share is that you're going to be part of a very unique and elite group of physicians way ahead of your curve. So as a pioneer in this area, I invite you to join me in the Wellness Doctor and Coach certification program. Hi, I'm Dr. Gabby Cora, and this is the mini video seminar for the Wellness Doctor and Coach certification program. Today I'm going to talk about outcomes and trust. Years ago, when I was doing my master's in business administration with a focus on health administration and policy, one of our professors talked about how we had data to show that doctors only needed 4 minutes with their patients to establish some great connection and have them trust them and want to work with us, and so that we could deliver our services nicely. Now, interestingly, this is a lot of what's happening in healthcare more and more. The true question is, are you sure you can connect with someone in those 4 minutes, create and build trust, and make sure that you can have a long-standing relationship? In some areas of healthcare today, many people don't care about whether or not they're going to have a long-term relationship, but there's some topics around the Wellness Doctor and Coach certification program where trust is going to be as important as the outcomes we're trying to collaborate with our clients with and or patients with to make sure that they can attain their goals and that we can be the best ones to serve them on their path to health and wellness. So why is this aspect so important? Outcomes is very important. We really want to make sure that if one of our diabetic patients is not following our guide or our direction, we really want to make sure that they're in good shape, that their blood sugar is the way it needs to be, and that they're not having any other kinds of problems as they relate to diabetes. We want to know that it's under control. But the truth of the matter is, can we establish a connection by which our patient is going to come to us, talk with us about information pertaining to their condition, and make sure that they follow our instructions and our direction? That's one of the biggest problems and one of the biggest challenges that we have, not only in medicine, but in coaching as well. So as we're thinking about this, how are trust and outcomes related? I've been a medical doctor for 22 years and a practicing psychiatrist for 17 years. And oftentimes, of course, patients come back to see us because they know that we've helped them. And why is it that they come? They want to know that they're in good hands, correct? However, throughout all these years, and also because I am a psychiatrist, I realize how important trust is, and not only the outcomes part. Why is trust important? A patient will come to us and will confide in us and will trust us based on their perceived knowledge that we have, their perceived experience that we have, and also the caring that we express in the emotion that they perceive from that interaction. In short, they need to realize, they need to know that we care about their health and well-being. So we don't usually create any kind of trust in just a few minutes like many administrators are teaching these times. And how is this very evident these days? Well, you can go to the best of surgeons at one of the best of establishments across the United States, and they can be very well respected, like a Dr. House was during the series. So if you're in a life-threatening situation, you will want to have the best surgeon operate on you. However, if you really want a long-term relationship, or a relationship where you can openly discuss your fears, your anxieties, your questions, your concerns with your physician, the only way patients and or clients are going to open up with you and tell them exactly how it is that they feel and what they want, the only way they're going to do that is through trust. Lawyers tell us all the time not to even say, "I'm sorry," if we've messed up with a patient. And while we can converse and discuss that for a long time, I want you to think about this. How do you think a patient will react to your recommendations if you're concerned, if you're empathic, and if you're able to sit and listen to what they have to say, as compared to a patient perceiving you as being aloof, uncaring, and just uninterested? These are going to be very important factors that are going to come in to play a huge role when your patient and or client comes in to work with you. Now, if you work within a healthcare model where you only see patients for about 10 minutes, this is really not a big deal. However, on the other end, if you really want to develop more of a health and wellness coaching practice, the model of being with a patient for only 4 minutes, just like everyone's teaching these days. When I mean everyone that is not a practicing physician these days. When you see that part, you really have to think about, how can I create a trusting environment where my patient is going to feel very well, very much at ease, very open about discussing what's really going on with him or her, so that I can best serve him or her. These are 3 tips that you can start practicing today. And by the way, if you're teaching or training, residents in training and or fellows, make sure that they're doing this too. The first one is, speak with your patient. Introduce yourself, let them talk about what brings them in to see you, and try to figure out, why is it that they're coming now? Why aren't they coming within a month? And why didn't they come a year ago? Or why wouldn't they be coming a year from now? So try to have a sense of their urgency in trying to see you. That's the first point. Establish a connection. It all starts with that first connection. The second one is, after you've made your evaluation and made the diagnosis, make sure that you sit down with them and converse about your recommendations. Don't make it a one-sided part where you're only telling them what to do. Tell them, give them different options of things that can be done. In some cultures, people will want to ask, they will ask you when they trust you. They will say, "But doctor, what would you do? What would you do if this was your father? What would you do if this was your spouse?" They want to know what you would do because they trust you in that regard. So make sure that when you give recommendations, those are culturally sensitive, depending on their background too, but make sure that you're not speaking at them, but you're speaking with them. The third point there, which ties to point 2, is this is a collaborative approach. We're really far away from the physician physician being the one who calls all the shots and the patients needing to just take it and do whatever you recommend. So the third point here is make sure that you create a collaborative approach. So you make recommendations, but you make sure that your patient knows exactly what it is that you're recommending, that they know the pros and the cons, so that you can work together as you help them gain their health and wellness. Thank you so much for joining me. And if you'd like to learn some more about the upcoming seminars that are going to be tied to the Wellness Doctor and Coach Certification Program starting in July, visit www.wellnessdoctorandcoach.com. Again, www.wellnessdoctorandcoach.com. Thanks for joining me. I hope you enjoyed the sneak preview of the Wellness Doctor and Coach Certification Program, and I look forward to seeing you in July. Now, how can you sign up? Very simple, by filling out a form that you need to request directly to me on my private email. What is my private email? It's gcl@drgabbycora.com. So write me a private email at gcl@drgabbycora.com. Request the form to sign up, and you'll be one of a group of 12 people coming in and joining me on the Wellness Doctor and Coach Certification Program. Thank you so much for watching. I look forward to seeing you in Miami in July.